call this meeting to order, and I'd ask that we stand for a moment of silent reflection. I would ask if any member of council has a pecuniary interest to declare it now, if no one, or at the time. Seeing none, I would ask if we have any items to rise and report from our in-camera session.
There are no matters to rise and report.
Okay. Delegations. We have 5 delegations this morning, so I would remind that we have a 10-minute for each delegation. If you can keep your time as close to that as possible, that would be grateful. And I would ask for a motion to allow the delegations to within the rail. Councillor McDougall and Councillor Gillis. Questions? All in favour of that? That is carried. Thank you. Our first delegation is Candy Hoven, and she would like to speak to us regarding the Patient's Bill of Rights. So would she come forward now? You want to come up here to the, yeah. No, just push it. Welcome.
Thank you. Honourable members of Lambton County Council, I would like to thank you for listening to me today. I'm speaking on behalf of my family and many other families as well. My mom became a resident of LMV, Lambton Meadowview Villa, in July of 2012, and my father joined her 2 years later. Due to some special arrangements made by Meadowview, on Meadowview's part, my parents were able to share a room until my father's passing last October. The frontline staff at Meadowview are exceptional and always happy and smiling. I do not have a negative word to say about any of them. My parents love each and every one of them like family. My concern is not with the staffing care, but with the changes that have been made recently with the elimination of bath shifts and the upheaval of all staff by shuffling shifts on all floors. Previously, the bath shift consisted of 2 people during the day and 1 on each end of the hall to add to the two PSWs on each pod. These bath shifts were short, but they were 2 bodies with 4 hands, and now there is 1 person to float back and forth between both pods. The afternoon shift is now expected to do baths as well as their regular daily jobs, and this has created chaos for residents. A pod contains roughly 20 residents. In my mom's pod, there may be 5 residents that can get around on their own power. The rest are a 2-person lift or a mechanical lift, such as my mother. This means while 2 people are behind closed doors to bathe, dress, or toilet a resident, there is now only 3 others on the floor instead of 4. Meadowview management tells me, in actuality, there's been an increase in hours on the floor, and I agree. From what I can see, there is 1 extra hour on the floor. But the problem is there are less bodies doing more hours and that's where the problem lies. There is a condition with the elderly people called sundowning. This condition makes residents very restless and more demanding to deal with. I have been there many afternoons visiting my mother. When bells are ringing constantly, residents are wandering into rooms, and there's lots of hollering and screaming of residents. This situation adds to the nurses' workload, and less bodies on the floor means more work for them and less care for the residents. My issue with all of this is resident safety. With 2 nurses attending to a patient when 2 nurses are attending to a patient and someone falls or an altercation breaks out, between the residents, there are less workers to respond to the issue. The elderly are staying home longer due to high numbers of applying and the heightened criteria to be eligible to get into long-term care. When they do get accepted to the home, they are now requiring more hands-on care than ever before. So less employees on the floor seems like a very poor decision to me. There are more and more workers off with stress leave and injuries and staff morale, and the turnover seems to be a bigger issue all the time. With the new schedule, staff is different almost every day. I'm sure my mom would be happy to have the same handful of people to bathe and toilet her every day. Currently, there are 2 different girls every shift each day. I would like to know where my mom's dignity and all the other patients' dignity comes into play. My mom can't speak for herself, and because of this, I feel she's being taken advantage of by the management of Meadowview. I most certainly wouldn't want these many different people handling me and seeing me this intimately. Residents in long-term care are protected by a Bill of Rights, and it states that there must be a staffing plan that promotes the continuity of care by minimizing the number of different staff members who provide nursing and personal support services to each resident. It is in my opinion that that is not happening. Having continuity of staff is a top priority. For some of these residents, the staff is their family. They by far spend more time with them than we can. The hardest decision I ever made was to realize that home wasn't safe for my parents any longer, and long-term care was a necessity. There isn't a day that I don't feel guilty for this decision, and I'm sure there's others in the room that feel the same way. Our parents worked hard their whole lives, and they deserve the best care possible. My mom deserves more care, not less. More dignity and respect, not less. It has become very obvious to me that the staff morale is at an all-time low, and I am a believer in staff morale starting at the top down. I do believe that as staff members are treated with respect from their managers and supervisors, this will reflect on their work, and that reflects on the residents. I can see with the many changes that it has affected the staff and definitely affects the residents within this home. I am my mom's voice, and she cannot express herself, and I am seeing morale is terrible within the home, and something needs to be done to correct it. Again, I will say it starts from management and supervisors to make sure that things run smoothly. I have always heard people say that it was so nice to work for the county homes and that the county had the great reputation for care and being a wonderful work environment for its employees. I can see that situation has changed tremendously for the worse, and I would love to see something done to make staff morale the way it was before. Safety is a huge issue. I do not understand how emergencies can be effectively done with less people on the floor. And what happens if a fire breaks out in a building where everybody requires mechanical lifts? I don't feel patient safety has even been considered in this process. I am also upset that recently there has been a new position, full-time director of nursing care hired to do vacation coverage at all 3 county homes. It seems strange to me that 3 directors of nursing care would have enough vacation time to justify a full-time employee for coverage. And it seems to me that the $100,000 to $150,000 salary mentioned in the job description on the County of Lambton website would have been better spent on actual frontline nursing staff, not more high-paid bosses. Letters to the family explaining the changes were dated and postmarked on June 2nd, 2017. The letters stated that the changes took effect June 3rd, 2017. This is disgusting, disgraceful, and clearly attempt to push changes through without allowing discussion from families. I have been talking to a member of the Family Council of Meadowview Villa about the changes. She informed me the administrator was present at their monthly meeting and discussed the changes with them. I respect this process. However, there was only 6 of 20 members present at the meeting. So the county was aware that not many of the members were present to talk about the changes, and due diligence would be to try and reach out to them, not just ram this through in a letter to the families the day before implementation. It seems to me that all of these changes were we're trying to get buried and happen quietly. I understand that change is a necessary part of life, but these are our loved ones and our money paying for this service. In closing, I would like to see more PSWs on the floor, the bath shifts reinstated, improved staff morale, continuity of workers returned, and patient dignity, safety considered before decisions are made. Thank you for your time.
Thank you for your comments. We will. Can you leave us a copy of that, or have you
Yes.
a copy available?
And would you like the copy of the letter we were sent from them as well, with the postmark on the envelope?
I'm sure we have that.
Thank you.
Questions, Councillor Boucher?
I have two questions. The first one is, I am a member of the Lambton Meadowview Committee, and it would have been easier for us to discuss these issues on the committee level. Why didn't you go to the committee? And the second question I have for the general manager, if she has any comments.
Why did I go to the administration at the home? Is that what you're asking?
Yes.
I didn't go to the administration or the director of care at the home because, quite honestly, in November, 8 weeks after my father passed away, my mom's roommate assaulted her. And the staff there were wonderful, but the management and the director of care handled it very, very poorly, to the point where I ended up having to make an OPP report. I contacted a lawyer. I contacted Bev McDougall, the warden at the time, and Bob Bailey's office and the Ministry of Long-Term Care, because there was no way that they were going to remove this woman from my mom's room. So the way this was all handled, I didn't bother going with them because I knew it would go on deaf ears.
Second part.
Has any comments?
Changes are a follow-up from something that started in 2014 when we started getting rid of the bath shift to spread the hours out over the week. The Long-Term Care Act requires us to provide baths respecting the schedule that people had before they moved into the room or into the home. So if we only offer baths on day shift, certain days of the week, it doesn't meet the Act. So in the other two homes, we made these changes over the last couple of years. Meadowview was the last place to make those changes. The new schedule requires fewer people to cover the master schedule, and council will remember at budget time, we were having difficulty filling all of our shifts. So Health Quality Ontario has a roadmap to continuity of care, and we followed that roadmap in the other two homes and looked at the data and decided to make those changes at Lambton Meadowview. We actually need a number of less people to cover the schedule now. And we do have a human resource crisis in healthcare. We do have difficulty hiring new people. We don't have a turnover problem. That's actually part of the reason why Mrs. Hoven mentioned about different staff. It's vacation time, which probably wasn't the ideal time to start our new schedule. But we have people with long tenure who do have a lot of vacation time, and we need to be able to cover that. And so we have to offer those shifts out according to our collective agreements, and that means that there's different people filling in for when people are on vacation. We feel that the offering baths when people want them is the best way to provide that, and trying to fit a whole lot of baths into one 5-hour shift is probably not the most respectful way to do it.
Thank you. Any other questions? Councillor Gillis.
Thank you, Warden, members of County Council, and thank you, Mrs. Hoven, for coming and speaking to us on behalf of your mother. You are a strong advocate for her, and I'm sure she's very appreciative of that fact. My mother was also at Lambton Meadowview for 8 years, and it was a wonderful experience, and I understand the guilt that you felt, and we went through the same thing with my family. Terrible sense of guilt, but had an assurance that where my mother was the best place for her. So I understand that when things like this go awry, it is so traumatic to you, more than probably your mother, more traumatic for you. But having said that, and realizing that this is a change that's starting to be implemented, this is a good thing for you to come and speak to us about, because clearly there are some problems as this change is being implemented. So I would ask again to Ms. Joris. Clearly, we've had this comment before at budget time about, I believe it was Councillor Napper who raised the question about staff morale. And again, Ms. Hoven is raising the question. So clearly there's some work that needs to be done. And I would ask if you are doing reviews on how this is being rolled out. And clearly Mrs. Hoven has isolated some incidences. So could you implement some changes or the necessary changes that would make this a little more streamlined for clients like Mrs. Hoven? Is that possible?
We did have a meeting on Thursday with the PSWs, and they brought forward a number of positive things that have happened with the schedule and some suggested changes as well. So we're looking at that. We did that in the other homes when we implemented the changes as well. Looked at a number of pieces of data around documentation accuracy, missed baths, which was greatly reduced when we made these changes in the other homes. So looking at some data, certainly I can bring a report. The staff morale, we just had mandatory training with everyone together over the last few weeks, and it was positive experience. I had lots of positive comments from people. So, and that's an ongoing issue. The staff work very hard with limited resources.
I'm not disputing that. Staff at LMV are exceptional. I've had that personal experience, and they are exceptional. What I'm seeing, though, and what I'm hearing is that the communications to the advocates, who are the children of the parents that are there, need more information about what is happening, why it's happening. And even though we have been assured that we have 1 hour more of service, I think that has to be communicated and described. Even if it's a sit-down meeting with everyone again, I think that needs to be done. I was the chair of the adult education program for a number of years, and we didn't hesitate to have meetings with the children of the parents that are in the home. So I would suggest that that would be a good first step to try to alleviate some of the difficulties that obviously people are sensing, to assure that we're doing everything we can, because we do have a wonderful reputation. The county has a wonderful reputation with regard to its homes, and I certainly wouldn't want to see that jeopardized in any way. So my suggestion is to communicate directly again to the, I keep calling you children, I suppose that's not very, very fair, but to the patients' advocates, if I may use that, because they need to be informed about what's happening. And I don't think we can diminish that in any way. So we have to make sure that we have contact with these people and they know what's going on, because they are their advocates. They are their parents' advocates, and they will come knocking on our door. So rather than have Mrs. Hoven and other people have to come to us to say that they perceive that there's a problem, I think we need to deal with that right now.
Councillor Mcgovern, Councillor Arnold, and Councillor Case.
Mr. Warden, members of the County Council, thank you ever so much for that presentation. It's not easy even to be up there, let alone talk about your family and your mother. I do appreciate the call that you gave me recently. I did do some research and checking. I did talk to some management people. I don't have an answer for you. I only have a suggestion for Ms. Joris, that perhaps, I'm not making a motion, but perhaps you could take a look and look outside the box. This is not the personal care. This is some of the services that are provided. Our daughter works at the Duke Medical Center, so she's home right now, so I had a chance to talk to her after talking to you and talking to Ms. Joris, that they do use robots, now, not for personal care, but robots are used at that hospital. It's a fairly large hospital. I'm not saying it's practical. I'm not saying it's reasonable. But I'm going to ask staff, whether I can or not without a motion, to look into other options. And I believe in Norway and Sweden there are some other options. You talked about security and safety in the room. I believe there are some bands that you can touch and that will not open unless it's programmed. So I guess I would ask staff to look into what other options are out there and maybe bring a report back in the fall or later in the fall. Do I need a motion, Mr. Warden, to ask for that, or will that just happen?
I think because of the presentation, this will be looked into and investigated and seen where we can go, and some recommendations will come back.
Thank you.
Councillor Arnold.
Thank you, Warden Weber, and I too would like to thank Ms. Hoven for coming in here today. It's not easy sitting there and expressing what's in your heart. And I guess just to reiterate a little bit, maybe we could have a report issued in regards to the concerns that were raised here today. And I guess what my biggest concern is when I hear that we've had an assault in a room, that drives me insane. And I apologize, Mr. Warden, if we had a report on that and I missed it, because I normally wouldn't miss something like that. And I think that council needs to understand what went on, what's gone on, and if there's other instances of the same, because it's something that's a statistic that we do not see. I know we've raised that concern ourselves in committees, but if there has been things that have been going on, I think this council needs to understand that and to help our staff with maybe some other suggestions for solutions on how to prevent this in the future. But I think awareness for us would be excellent. And I guess I'm disappointed that that was that long ago, and I'm hearing about it today for the first time. So thank you very much for coming in, and thank you, Mr. Warden.
Thank you. Councillor Case.
Yes, Mr. Warden, this is obviously it's a serious situation, but as Mrs. Joris has already said, there is a crisis in healthcare in the province of Ontario. And I do believe our folks, obviously with the presentation, they're going to do their due diligence. It's already started. Mrs. Joris has already said that she's going to bring back a report on this situation. So again, I just want to caution council a little bit. We're almost to the point where we're micromanaging. And I don't like micromanagement. I never have, and I never will. Obviously, we have a right to ask questions, and we have a right to obviously push our concerns forward. But again, I believe that Mrs. Joris has already said she's going to bring a report back. I mean, we're all looking forward to seeing that. We do have to do better. I mean, there is a crisis, a healthcare crisis in Ontario. We're going to hear more about probably some of that stuff today with one of our other presenters. So again, I just want to caution county council, we have to be very careful that we don't cross the line when it comes to micromanaging. We let Mrs. George bring the report back. Again, the issue today that was brought forward is serious. I don't make light of it, but I think we need to give our staff the proper time to bring back a report and make some recommendations. After all, that's what we hired them to do. Thank you, Mr. Warden.
Thank you. Councillor Napper.
Thank you very much, Mr. Warden. If there's a report coming back, could the minutes of the family committee, I don't know what they call it, I don't know, when the residents' council get together, stuff like that should all be brought up at that. Could we get the minutes of that, come back and reflect it on there?
From the Residents' Council, you'd like to see those minutes? I'm
there on a daily basis, I guess, and there is a lot of unrest over there with people, and it needs to be looked at. And
thank you, and thank you again for your report, and we will, you'll hear more. Our next presentation is from Ralph Ganter. Update on the status of the resident withdrawal management for County Council. So please come forward. Welcome.
Thanks very much. Can you hear me okay? Just get myself organized. Actually, I'm very interested in the previous presentation as well. Obviously, with long-term care homes, we hear this type of situation quite often across our land and across the province. I know just recently we've put some investments also into behavioral supports and I believe some additional nursing in terms of primary care. So I'm interested in looking back at this as well because it's something that that's of interest to us as well. So I'd be interested in working with you as you start to look at this incident and as we start to look at some of our information. It says in the agenda that I'm supposed to speak to withdrawal management. When I was actually asked to come, it was to talk about transition, but I'll touch on withdrawal management because we've got some good news at the very end. So I see my clock says 9:31. So what I just wanted to spend some time on is we've had some significant transition in healthcare in the last number of months. Since I took over, we've been involved with this Patient First Act, which one of the hallmarks is to have the CCACs across the province transition to the LHINs. And remarkable due diligence has taken place. We've been spending, at least the last 8 months going through all the different elements. This is a slide, and again, I've just got a couple of slides, and you can take them with you afterwards, of course, and have a look. And if you have some questions, feel free to email. But since about last November, and with the actual passing of the Patient First Act, we've been going through significant work with the ministry to do this transition. Our transition took place about 2 weeks ago on June 21st. And June 22nd was quite a relief to have that behind us because really we didn't want to have any patient impact at all. We wanted to make sure that the transition was as seamless as possible with respect to moving into an operation that has more than 400 staff members. And just so you know, we've taken on all of the liabilities, all of the contracts, the staffing and the sites and so forth with respect to CCAC. So now we're getting into this transformation phase. You'll see that on the left-hand side where it says transition, there's a number of pieces there. Our governance has expanded. We have in legislation now 12 board members. And in terms of local board members, we have Dr. Mike Orr from the Grand Bend area. We have Nora Brissett from Kell and Stony Point. And we have Rick Charlebois, who is from the Sarnia Lampton area and, of course, had worked in Petrolia. So we're growing our board in terms of having the governance and the skill sets that we need to, make sure that we, move the healthcare system out of crisis and into something that gives us the best possible patient outcomes. In terms of our transition, all the little things, of course, is, we are a Crown corporation. We can't have a line of credit, so we have to manage our cash very, very closely. We have oaths of office. There's a lot of, personal health information that we have to be very, very careful about. And one of the pieces, just so you know, 14 LHINs across the province, we have now a pretty robust corporate services entity, shared service, which is our legal services, all of our IT, especially around home care. And it's a pretty robust back office that we can draw on to really enable us to focus more on care as opposed to some of the administrative pieces that goes on behind our work. Let me just see here. So of interest, again, we moved all the CCAC employees across into our system under the transition box. The last bullet, you can see that we didn't lose any frontline positions. The intent was to bring everybody across and keep everybody as calm as possible. At the same time, we were asked to save 8% on our administrative costs, which is what we did, and we actually did beyond that. And again, we want to make sure that all the frontline services are maintained, and actually we can grow them now. So in terms of transformation, you'll see the next series of boxes is we really start now to work more in the primary care realm, more into service, and we have these areas called subregions, which I'll just show you a map of in just a moment. But it's been quite the transition, taken a long period of time. Great lessons learned, and like I say, happy that we're on the other side of it. I have a slide here that shows some of the changes that were enabled. Again, lots of bullets there, but what I'll just say is, obviously, having the client as a greater voice within the planning is going to be key. And you'll see that we have a bullet there under system transformation that says strengthening the voices of patients and families. We also will have patient family advisory councils that help us with almost every element of planning of healthcare and making sure that, especially what we heard before, that we get that kind of feedback so we can actually react to it and move forward. This is a little bit of an interesting slide. It shows what home and community care profile looks like across the province. Pretty significant in terms of, you see there a bullet there about short stay. 60% of clients are on this sort of terminology called short stay, which is acute, rehab, and end-of-life type services. And then we also have a number of patients within this long stay, and we see that in our LHIN in terms of people who are at home with a lot of service so that they can stay home safely. And this will be interesting for us to look through. When you see on the bottom right, there's a box there that says Referral Source. I was interested in this because it says there, if you read it, that 50% of all home care services are being referred from hospital, whereas 14% were from primary care. I'm interested to see what our numbers are because I'd like to see that really change. For me, it's almost too late if it's in hospital. I'd like to see the ratio, in a sense, move that we have much more referral from primary care as well as from self-referral. So that'll be an interesting number for us to watch as we move forward. Next slide. So here are our numbers. 1.9 million units of service. We see 27,000 unique patients. Works out to about 4 to 4.5% of the total population. Right-hand side, you see a snapshot of what the home care services are and lots that you can speak to in terms of all of those bullets. There's one bullet there about self-managed home care. It says telehome care. It's one that we're really quite interested in. We've piloted this now for a number of years, and we're seeing outstanding results in terms of preventing emerge visits and admissions, especially for complex patients and high-risk patients. I'll just keep going. Subregions, part of the Patient First Act was for us to have a more granular look at healthcare utilization, healthcare costs, and most importantly, patient care outcomes. We've always had this type of thinking as part of the LHIN. When I was part of the regional office and came to LHIN, I've always looked on a county basis to make sure that we really see what's happening, because when you look at averages, it masks what's happening, right? And if it's too big, you don't get down to the actual performance improvement. So what we have is, although it shows there as 6 subregions, the way we're going to operate is we will actually theoretically have 4. We showed Chatham-Kent there as being 2 subregions, and when we were asked to do this, we were right in the middle of an issue with the Chatham-Kent Health Alliance with respect to a supervisor. And what we had and what our board had seen at that time was that really that there wasn't the attention being paid to the rural communities as there was to the urban. So we wanted to make sure that we institutionalized looking at the rural areas, and that's why you see that, I'll call it a bit of an aberration or an artifact. Clinically, administratively, we treat Chatham-Kent as one. We'll treat the city of Windsor as one subregion, and you can see that to the periphery as well as Leamington will also treat administratively as one. But when you look at Lambton, I think you've seen some of our information in the past. We actually divide Lambton into 3 areas within the subregion so that we have better granularity in terms of what's happening in each of those areas. And we also have the ability through postal code dissertation to really, get down into neighborhoods to see if there is something that we call social deprivation index, or if we can, really look at, are there hotspots within an area that we can address. So for us, again, this is our work going forward. We are focusing ourselves on this type of subregion. And there's a lot of myths out there as to what subregions will and won't do. They're not meant to be at all administrative boundaries. If they are, you have to tell us right away because we have to stop that if that becomes the case. But you can see on the left-hand side, obviously we want to have this focused approach within our areas. And you see a word there that helps us to better identify variation. We can't be afraid of variation. We can't be afraid of missing the mark, because when we do that, we go back and we look really hard and make sure that we make the adjustments. What I'll just do is I'll go quickly. Accountability is so important for us. It has to be even more important. What we do on a quarterly basis now is we provide our LHIN board with this type of data. We have quarterly meetings with all of our hospitals and community providers to look at this data, to come up with 90-day action plans so that we can advance ourselves. We also have quarterly meetings with the ministry, so the ministry is absolutely in tune with what's happening locally, what our initiatives are, and if there's a best practice from across the province, how can we bring it here? I'm a hockey fan, so of course this looks like standings to me. I see the top 8 as being the playoffs, the top 4 is home ice advantage. It's a good way to look at it, but we're talking about people here, and I would like to see us in the top 4 in all of these categories. So that's where we want to go. But I'll just give you a couple of examples of what you're seeing here. The biggest issue we have is if you look at the bottom, the time scale. We get our data late, right? So it's almost like, again, the sports analogy, the Detroit Lions playing by watching last week's scoreboard in terms of the score and timing. So we're late in terms of the data. What we're going to start to have now is on a sub-region basis, obviously data that's more real-time so we can react. But I'll just show you, there's a couple of different examples. Obviously with the PSW nursing and so forth doing fairly well. When we look at ED department for complex patients, we're number 6. For minor lengths of stay, number 8. I'll just keep going. You can see in hip and knee, we've really improved quite a bit. We used to be really quite low, but in knee, we've got to make some adjustments. Mental health, okay, look at where we are with respect to mental health. So you can see we've got significant work that we have to do on this side. And you can see also that we have ALC rates that have improved dramatically. And the last one on the right-hand side, readmissions. 2 years ago, we said to ourselves, if there's one thing that we can work on that makes the healthcare system better in terms of utilization and cost, it's readmissions. So you can see we focused on that, and we've improved to being number 2 in the province, and we want to make sure we sustain that. But it just shows you that if you really focus and put all your attention to it, you can come up with some pretty good results. What I'll just show you on this slide, and this is, and you know what, it's so important. We can't be afraid of showing our numbers because we have to look at these, and now we have to look at them from a sub-region point of view as well as a county basis to make improvement. But I'll just show you on the far right-hand side, obviously patient experience and satisfaction, really remarkably bad results that we have to work through. And over on the, you can also see palliative and home support. This is so interesting for me. We have put so much money into end-of-life care and palliative care. We have hospices in each one of our major categories, and look at where we are. So are we focusing on the right thing? And one of the things that we're looking at is some of the numbers, such as anyone who's gone to the emergency department in their last month of life 3 times, looking back and analyzing what happened there. How can we adjust? Is it rural populations? So that was, I just wanted to show you these numbers, but the point I wanted just to make is measurement is so important to us. We've got to learn from each of our actions. We're going to continue to focus on that. We'll start to see numbers now with respect to our sub-regions, with respect to Lambton County, and see where it is that we're seeing changes. And we have a pretty aggressive system whereby we want to have these numbers improve. So this is very, very key. Getting over to withdrawal management, don't want to spoil an announcement for next week, but obviously we have good news. So I don't have to use the word imminent anymore. I think I used that, 3 months ago, and I've been quoted 100 times with the word imminent. But we actually had the documents executed between ourselves and Bluewater Health, and I think I saw them last night come through to Bluewater Health, so there'll be an announcement next week. So I don't want to take away this is Bluewater Health's hard work. It isn't our hard work. We guide it as much as possible. But you'll hear that announcement that obviously the opioid strategy is very, very key. Ministry is really quite determined to get on top of it. And the withdrawal management is going to be something that's key to that. Again, not spoiling the announcement, but if you recall, I think I told you that this is sort of a 4-stage process with respect to capital. The hospital will be able to enter into something called Phase 2, which is the detailed planning behind withdrawal management. So some examples of what will be done now is making sure that we know what the range of services are, what the space requirements are based on the number of beds, the service volume, so we make sure we've got size properly, how many full-time equivalents will be needed, and the budget, of course, for that. What are the cost estimates, the project schedule, and it's so important that we have a very tight project schedule because we have to achieve this now. We can't wait. We've waited too long. And of course, the site selection and site search. is everything that takes place within this phase. So you'll hear next week, of course, that planning grants and so forth to help out with getting this done in a fairly brief manner. And the next phase, just so you know, is the next phase will be the actual tendering, and then the final phase is the actual implementation and reconciliation. So we're into the personally, I just got to tell you, we're into a great spot because now this is a project between us and the ministry. It isn't just a Lynn trying to find it within our operating. I'd rather put the operating dollars into nursing as opposed to leasehold improvements. Now we have this, and we'll have the expertise from across the province to help us with this. And more importantly, we'll have timeline, project management, and so forth. So sorry, didn't mean to go over, and I know your time is precious. And I should probably next time spend more time on this, but I won't use the word imminent anymore because we're past imminent. Okay, and again, try not to talk about this because this is Bluewater Health's announcement, and it's best that they take the kudos for the work that took place behind this. So,
okay,
that worked.
Thank you for that presentation on the LINs, and we will wait with anticipation for next week to what come up. Councillor Boucher.
I'm a very key person, very low-key, very kind person. But this morning, I can't help it. I don't think I can feel like being too kind. If I was drinking, man, I want to dry up. I said that last time. I would be underground by now before that building goes up. It's not such a huge, big building. Why is the delay? Why do we have to go years and years reminding you, Mr. Speaker, that this is urgent matter for our community? I mean, I saw those figures. I saw those reports. You have been here before. How long can we wait?
Oh, sorry. Yeah. I'm colorblind, so I can't tell the difference between red and green. This is urgent for us, right? We've got to get this done. Even yesterday when I was at the ministry and in terms of speaking to opioid strategy, do we have to wait for a facility to put together withdrawal management beds? Is there a way that we could put it into space right now? So this is an important project for us. You see our numbers. We want to make sure, and the numbers hide what's actually happening to people. So this is paramount for us as well. This next phase, this is ideal for us. We want to get this done, and this accelerates it. So I'm not sure if I can give you a timeline. Timeline will come out of this work, but it's top of mind for us. We've worked at this for too long, and we want to get this done.
Okay, thank you. Councillor Gillis.
Thank you, Mr. Gandy, for your presentation, and thank you for the non-announcement. I think it is good news, and I'm really looking forward to when the actual announcement happens. Glad to hear, though, that you're working directly with the ministry on this now, and everything has been signed, because those are the key steps to going forward. But I want to take you back to the reason that you're actually here with regard to the CCAC. I was quite concerned when I saw the sub-regions and the way that they laid out. So I'm glad to hear that you've explained that a little bit more, because I was quite concerned that our region was losing. The other thing that I wanted to ask you about was many people have referred to the CCAC as a nightmare trying to get through it. And most people don't have any experience with it until they actually need it and they're in crisis. So how is this being streamlined now, or is it going to be streamlined so that when people are in crisis and need the service, they will be able to navigate it without having to have a degree?
Oh, sir, button back on again. Great question, and we've had the CCAC for all of 9 days now. So this is what we're doing as well, is we want to make sure we know exactly how it's operating. And part of it also is there's so many layers to this. It's kind of interesting. We want to provincially make sure that we have at least the same basic basket of services for each sub-region. So when that is determined, and that's work we're doing this summer, how does each sub-region map against those basket of services? So, for example, assisted living, it's one of those elements that we want to expand on, because not everybody needs to go to long-term care. Also, in terms of dementia strategy, day programs, right? So these are all elements that will help take pressure off of CCAC. But the key will be, is exactly as you said, is now from the sub-region point of view, we will reorientate ourselves. So we have one of our, and this is no new staff, this is reorientating ourselves. We'll have a sub-region director for each area. We'll have a CCAC case manager for each area. We will have a physician lead who will be hired as part of our staff to help us with the navigation of patients. And also the public health will have to be key because of those type of situations, especially when we get into flu seasons and so forth. More importantly is, as you see, our data is so slow and late, we need something that's real time. We'll start to have information that's daily. So if we see that there's a series of people in the emergency department waiting for something, we can do something faster. And the last element, and again, there's so many variables that are part of this, but one of the last elements is we depend too much on long-term care homes or hospital. There's a service in between that we don't have. And I think you'll see in the next number of months, and months again sounds like a long time, but this is the work that we're going to be doing, is there's a significant amount of retirement home space that is unoccupied in our LHIN as well as across the province. The issue we've had over the years is we could never pay for the occupancy costs for retirement homes. In the provincial budget, and what we're going to be working through now is sort of a voucher system so that people could go into a retirement home and we can place CCAC services around that person. So it's not quite long-term care, but it hopefully is good enough. I can't believe how I'm saying it. I just want to say so that we can get people built up so they can either go home or perhaps the transition to long-term care is delayed. So what you're saying is our work. What I'm doing personally is I'm going out with all the case coordinators. I'm visiting patients. I want to hear what they're saying to me. Right now, they're showing me all the patients who are really nice. I want to see the patients who aren't nice, right? And really get down to understanding what's happening, because what we'll have to do then is we'll have to assemble services around those very, very unique needs. And I'm going on, and I know there's so many variables. We can go forever, right? The other key service that each sub-region will have is a Health Link program, whereby we assemble services around the top 1% of the most costly patients. That's work that we're doing now as well. So many things. I mean, we have to keep coming back to let you know what we're thinking of and how it works. But 9 days in, we're learning a lot every day. So.
Follow-up, Councillor Gillis?
Yes, thank you, Mr. Gander. I appreciate that approach that you're doing. Not to prolong, but there is one other identifiable group that sometimes gets overlooked, and that's the children of that are medically fragile or have mental deficiencies, that parents are looking after, aging parents that are in their 80s. Is that part of your variable group that you are trying to find solutions for?
Exactly it, and we have this thinking about HealthLink, but we've had some situations, and we do this every holiday. We have a call before the holiday and after the holiday because we've seen historically where people get dropped off at the emergency department because they can't, the elderly parents can't deal with that. So that's really key for us. We've been monitoring this for a number of years, and when we've had these types of situations, we've usually put patients into, say, a convalescent care bed just until we can at least assemble resources behind that. In my mind, I have a thought around something like almost like a medical hospice that's set up so that if we have these type of situations, people aren't waiting in the emergency department, we can at least do something. It's almost like respite. So we want to see if we can develop that, but it's a key population, and it's one that's going to grow for us, right? So, yeah.
Thank you. Seeing no one else, thank you for your presentation, and again, we will look forward to some announcements and some moving forward on this detox. All right, we won't tell anybody. Our next presenter is Gail Montgomery from the Circles program, and she has a short video for us, so welcome.
Good morning, Warden and members of Council. It's a pleasure to be back, to see you all and hopefully provide a brief update on both Lambton County circles and the larger expansion to Circles Canada. I brought, this is Faces of Lampton from one of our recent marketing endeavors, and so I just want to bring to your attention, these are people from our local community. You'll see our amazing Circles team up in your far right-hand corner that have been staff designated to this initiative for quite some time. But I really wanted to highlight the bottom right-hand. You may remember the faces of this family from when Councillor Arnold was warden, and he so graciously donated the warden's car to this young family. Just to give you an update, it provided an opportunity for DC to take an industrial machinery course. He was hired immediately. He's been promoted twice since then. He now drives a company truck. His wife is a full-time PSW, and they've also welcomed a new baby into their family. And so I believe about last year they finally had to trade in for a larger family van, but they continue to do very, very well. Oops, going the wrong way here. So the overview of success of Lambton, as of January 1st, 17, we had 140 families that have participated, and some people stay for 8 months and some stay for 5 years, depending on their movement forward and how long that takes. What's significant is that we know as of last January that 51 of the adults involved in our program had reached their goal of self-sufficiency. And how we can even begin to estimate the cost savings associated to the municipality with their success here and now, as well as that generational piece for generations to come with their children. We now have 7 communities involved in Circles Canada, with 2 or more that we're working with now that are expressing an interest to join this very successful community initiative. We have just currently rolled out a data system for Circles Canada, which is the first time. If some of you will remember that was an issue we had with Circles USA, that we weren't able to get a data system. And so Lambton took that on in the fall, and we have just last month rolled it out to not only our own staff, but the other sites across the province. So we're very excited that in the new year, we will have some spiffier data. One quick comment on that: when we were in the training room, actually the fellow that owned the company came to our first training rollout, and he was starting to click with the live data that Lambton staff had put in on their current caseload. And he was showing me how he could come up with a graph, and the thing that he chose just happened to display that currently almost 19% of the leaders involved in Circles identify as Indigenous people. So that was just an interesting, he's like, this is how I would make a graph, and yet to me that was quite striking to have that little piece of knowledge about our current situation. We're getting a great deal of attention because of the success of Lambton Circles. And we continue to have amazing support from the community. The Seaway Kiwanis continue to fund our children's programming. And this year we were successful in getting a large donation from 100 Women Who Care. In fact, over $17,000 that were directed absolutely into the hands of the leaders and their families to remove barriers to their success moving forward. So what's next steps? What have we got in the works? We're delivering an intensive life planning workshop this summer for youth at risk in partnership with North Lambton Community Health Center, and we're delivering that at the Hub. And ever since they announced the creation of the Hub Circles, we were very, as a large family community, determined to get involved in some way, because our leaders, that's their community and some of their youth. And so we finally found a way that we can provide an in-kind support, and so we're excited about that. We're ramping up to deliver our Getting Ahead workshop, which is always the beginning to Circles, this fall in Forest, in partnership with North Lambton Community Health again and Kettle Point First Nations. We are going to assess if that initiative is successful, meaning that enough people come out and take the program, that then perhaps we can actually move forward in early 2019 or 18, in establishing our first ever rural circle, which would be something that I know that it would please everyone here as well as ourselves. So Lambton Circles continues to be the strong foundation on which Circles Canada has now been built, and none of this would have ever been possible without the support of this council and county senior staff. Folks throughout the province are inspired by us to take a deeper look at their anti-poverty strategies, and as a result of the remarkable experience that we've had here in Sarnia Lambton. So it's one thing for me to provide you with an update report, as I do from time to time, but I'm hoping that the debut today of our new video will allow you to feel the impact of Circles in our community. And so, Jay, roll them. Good evening and welcome. I'm Gail Mcgovern, National Recruiter for Circles Canada. Standing with me this evening is my amazing Circles team, Kim, Mary Lou, Kelly, and Martine. 8 years ago tonight, we held our very first Circles weekly dinner with 12 leaders and about 18 allies. We had the funding support of Lambton County Council and Social Services Senior Management. We had community partners that advocated for our cause. We had allies that answered our call with open hearts, and most importantly, we had leaders that were determined to do the hard work required to move forward on their plan of change to self-sufficiency. It's been an amazing journey from those early days to literally becoming Circles Canada. Please stand up and remain standing if you are a graduate leader who has reached your goal of self-sufficiency. You're a leader that has graduated post-secondary education or a training program. You're a leader working towards your education and training goals. You're a new leader excited to start on your plan of change. You're an ally who has supported leaders in their journey. You're a child care provider who has helped our Circles kids develop their future story. You are someone who believed in these families and helped them start on this journey. You're a Circles champion who has provided support to the Circles initiative. Take a moment, please, and look around this room tonight. Everyone here has enough reasons, resources, and relationships to thrive. Ladies and gentlemen, this is Circles.
Okay, so who's gonna go first? We should decide that before.
Rock, paper, scissors. Come on, guys. Rock, paper, scissors, shoot. Rock, paper, scissors, shoot.
Circles to me is a safe place to go in, kind of talk to a variety of different people and kind of get opinions on whatever you're struggling with.
I like Circles because I get to play. It's just a place to come and talk and have fun.
Circles means someone being there to support you.
My favorite part about Circles is food, friends, and party. Yeah, it's pretty much fun, enjoy, and be happy. A great place, and parents can come there to know more stuff.
Circles means to me having people to talk to and having someone to always help you.
It means where you're safe, there's no bully, and there's a lot of teachers to keep you safe. And you will not break any bones.
Circle means like a lot of people to go and join together and learning a lot of fun stuff, kind of like school.
Circles means family. We're always there for each other.
It makes me feel happy when I come to Circles to play.
When I started Circles about 8 years ago, I was broken. I felt alone. I felt like I had nobody. I didn't want to trust people. I was on social assistance, a single mom, recovering addict, and I just felt like I wasn't worthy.
For a long time I had accepted that I was poor and my family was poor and that's how it would be.
What Circles has brought to me is, a sense of belonging, a sense that I am better than who I am. Even though I live in poverty, it brings me out of my shell because of the supports that Circles offers me.
They saw something in me that I didn't see in myself, and helped me to feel the hope that I actually am able to accomplish different things in my life.
I joined Circles because I realized I had a pretty bad attitude towards people in poverty, and I realized that I really needed to understand it better. What I realized was that everybody just wants to belong.
Circles has brought a lot more to my life than I could probably even put into words.
A lot of confidence, a lot more outgoing. I enjoy being around people, and I like to get involved around the community.
They have shown me that my resources are not limited. I've always had a hand to hold me through my journey that I've started 6 years ago.
I've seen their courage. I've seen what it takes for them to meet that struggle, to keep fighting and to keep going.
This program is actually doing what it's meant to do, and I'm part of that in some way, which gives me fulfilment, because I do see that people do move from poverty to being self-sufficient, and that's so rewarding.
I could very well have been a leader, and I think just the fact that I was so close to being on the other side makes Circles so unique in my mind.
Circles to me is kind of like forming our own little community where we look after each other the best we can, and if I can't help somebody, there's somebody else that will have the information that I need to know to help my guy move ahead, and that to me is very important.
It certainly brought a lot of interesting people into our lives, and they've become friends.
One of the things I really like is the meal that we have together. Once a week we have a family atmosphere when we have that meal together, and I think it's a really good bonding experience for everybody who's there, including the kids.
Well, for me, Circles has given me a life. They taught me that I'm somebody in my community, and to make others know that they're somebody too.
Circles has brought stability, a second family, someone to listen when I need someone to talk to.
Circles helped me recognize that it was a possibility to escape poverty.
If I were to tell you one thing that Circles has taught me, and there's many, is I have learned that the people with the least give the most. I think that Circles has saved many, many lives in people that probably would not have made it.
I've become a person. I didn't feel like a person before.
Thank you for that presentation, and thank you for the sharing with us the successes that you've had and continued success. Councillor Arnold had a question.
With you, and it doesn't seem like it's that long ago that Mr. Fobister stood up in here and trying to convince everyone that this was the way we needed to go, and then you took charge of everything, and when you think of that original Bridges Out of Poverty and where the county was trying to go, and the trips to Toronto and trying to convince different ministers that this was a way out, that people kept their dignity, and they learned and they could grow and had support. And I just thank you. Thank you very much for continuing in this program, you and your team, and all of your leaders for sticking with it, because it's not easy. And we see it every day, and we just thank you so much for your continued involvement, and you make us very proud in this county that we're moving forward in a positive way. So thank you very much.
Because we would not have been able to even dream without the support of most of you in the room. Today, we're back in that time frame. So we're all very grateful, and leaders as well, for the continued support. And it makes me proud when I travel the province and now teach others to, follow in our footsteps. So thank you very much.
Thank you. Oh, I had one more question. Councillor Han.
Sorry, not a question, more of a comment. I just wanted to say congratulations on your awesome video. Sometimes, the visual is really a great way to get the story across, and that was really heartwarming. Thank you.
Okay. Our next presentation is from Rick Smythe, Bayside Centre, to talk about the redevelopment of the Bayside Centre from Seasons Retirement Communities. So, come forward. Welcome.
Thank you. Good morning. So I don't have a formal presentation. I'm here as the CEO of Seasons Retirement Communities. We've made an investment in the Bayside Mall in downtown Sarnia that most of you are likely familiar with. And we have spoken with Sarnia City Council, and effectively this is the same discussion that we had with them. So I'm here to answer any questions that any of the council members may have to try to help with, let's say, clarity around the project and where we're going and timelines and that type of thing. So.
Okay. Councillor Bruzewicz.
Thank you. You have assured me at the time when you made the presentation to Sarnia City Council that you're in it for long term to build it, develop it, build it, and perhaps realize some benefits. I'm a little bit curious, like I'm not questioning you. You mentioned in your presentation to us here about bringing the third party at certain points to be complementary in your development. It's not beginning of you unwinding. Is that party going to be diluting your equity in the project, so it's almost as if you're realizing the value, or they only on temporary basis and will help whatever they do? Can you elaborate on the need for that third party getting involved later in the development?
Well, we run operate 21 retirement communities in Ontario and Alberta, and we have a half a dozen projects that are under construction. So we're in the retirement business. We're not pure developers. While we build our own communities, we are not in the commercial retail office or other real estate business per se. So what we're doing is we've hired cornerstone architects from London to master plan the site. This is a very large site in any community, effectively 10 acres downtown. So as we'd indicated to Sarnia City Council, I mean, our intentions are to ensure that we do all of our due diligence up front and that we get this right and we get it right the first time. The primary focus is going to be on the development of our retirement community. And let's say complementary services. The point of the fact that with a site this big in a community the size of Sarnia and Lambton County and the services that we would see as sort of highest best use in this location, we're not going to play developer and determine sort of exactly what should or shouldn't happen outside of our retirement. So the discussion around bringing in a third party or bringing in a party to work with us will determine what the right structure is at a point going forward, and it'll be tied very closely to with how the master plan comes together. But again, I don't think you're saying this. We are not in this to sort of flip a portion of the property, if that's what you're trying to get at. We don't do that. We are invested in this. We are invested in cash. We expect that at a minimum, our investment in this site will be something in the neighborhood of $60 million. It may be more than that, depending on how the plan comes together. But we're in this for the long haul. We will take responsibility of the entire site, and it'll be up to us to make sure that we pick the complementary partner that will help with highest best use development of the remainder of the site.
Thank you. And you answered the question that came more from curious than any other thing, so I'm very satisfied with your answer. Thank you.
Councillor McDougall.
Thank you, Warden Weber, and thank you, sir, for being here with us here today. We operate the shared services facility from Bayside Centre, And I know that I negotiated somewhere around 257 or some odd parking spots out of the parking facilities on that 10-acre site. And I see that you're looking to 140 to 160 assisted units on that site as well. I too am interested in your consideration, although I was a little bit worried when I read that you will consider bringing in, so I'm glad to hear that it looks like indeed this is going to happen. But there is a significant other portion of the property beyond retirement living in our own use of the facility for shared services. But there is also, it is the largest inventory of available parking in the downtown. How many parking spaces do you believe will be available past whatever you intend to allocate for your retirement living that would be available to the community, the downtown business community, the residential community down there, and also some of the cultural facilities, because we're also in the business of cultural service delivery here through the County of Lambton. So we have our own JNEG gallery down there, but there is some percolating after hours and cultural activities down there with the Imperial Theatre and other facilities, as well as our vibrant library program. How many parking spaces do you anticipate will be available past what you will need for the retirement community itself? I think there's something like 980 parking spaces in total, above and below. So how many will be available for community use?
Well, I guess the one answer to the question is our intention is to not reduce the parking. If we have opportunities to enhance the parking, create more parking, that'll really be an engineering discussion ultimately to do with the site conditions. Part of the master plan process will drive the usage of square footage with different buildings and the number of people that could possibly be brought to the site. So we're fully cognizant of the parking issues in Sarnia and downtown, and we made as much as we can make this a commitment, where our intention is to not reduce the parking spots. So just as a matter of being correct and accurate, we're not in assisted living. Okay, we are providing independent, supportive living retirement. And I know that there's lots of different ways of labeling these type of services, but I want to be very careful to confirm that we're not in long-term care. We will provide some assisted living to support our residents aging in place, but I think we have to be careful that this is very much a very highly active, mobile community, independent living, independent supportive living. We're providing memory care, and we will provide sort of assisted living to the notion that we look after our residents and we allow them to age in place as long as possible. So just want to be clear on that, so everybody knows that what business we're in. And again, our parking count for the retirement community itself, it's very low. Typically, it's sort of one parking spot for 2 suites, so it's sort of lowest on the parking count. So we're not going to impact, our retirement community isn't going to negatively impact. As some of you may be aware, there's an excess of 200 parking spots that have been closed down there that haven't even been brought to the market. So you may have seen we have a couple of articles in the paper or advertisements just letting people know that there is parking available. We've gone back to the old rates because the previous vendors sort of scared a bunch of people off by trying to jam the rates up. So we're not fussed about trying to turn the parking into an economic return. This is more it's a service that we're willing to provide while we continue to go through our planning processes. So I can't give you a hard number, as I suspect you're aware. But the point would be that we're not intending to take any parking spots away, and where there will be opportunities to add parking spots depending on density for whether it's commercial retail uses or potentially other residential uses, then we'll look at providing that. A lot of those, as well, appreciating, are all part of the discussions both with County of Lambton, City of Sarnia, planning staff and engineering staff to determine sort of what we can and what we can't do, and considerations around the bus and traffic patterns and a whole bunch of other things. So we need to be cognizant that those all come into play through the planning process here.
Thank you. Councillor Mcgovern.
Mr. Warden, members of County Council, thank you for your presentation. Wish you all the best. 2 comments or questions. What's the timeline? I may have missed it. And are these high-end suites, or are they like maybe a poor guy like me?
Again, timing is all part of the planning process, and anybody that's in either real estate or has done some planning will appreciate that, you know, trying to plan 10 acres, repurposing 10 acres downtown in a major community, along with making sure that we're doing the best possible to look after the tenants that are already in the mall itself. You know, this is going to be sort of challenging from the perspective. So a hard deadline, you know, I can't give you a hard date. I can tell you from my perspective that we're burning money there, and our first plan, well, it may be it could be 2 or 3 phases that could be underway concurrently. Our plan is to get into the ground and build a retirement community, you know, once the planning is completed. So I would expect, and I'm not going to be held to this by press or anybody else, but again, we're invested in cash in this site right now, and with no return being generated. The intention would be to be in the ground for the spring of next year on our retirement. So we're not going to sit by idly and just sort of try to figure out what our plan is. This is why we're focusing on the master planning. We have a very aggressive schedule with Cornerstone. We're meeting every 2 weeks, and we've actually already sliced and diced the site up half a dozen times, trying to figure out sort of what makes the most sense for what potential services could be brought back down to the city core, in addition to our retirement community. And I do want to be very clear, again, and John Ennis and I have spoken quite a number of times. Like the county, the shared services, it's an absolute priority to make sure that we do this right. So we will be very collaborative. We'll be as transparent as we can. But I mean, this is somewhat of an informal partnership, let's say, between the county, the city, and Seasons Retirement Communities. And the expectation is this to be collaborative, and with both parties, we'll have a seat at the table as we start to develop the plan. But it's just a bit premature at this point. So,
okay. Thank you for your presentation. Hope we see a positive turnout for this event, and we wish you all the success. So,
all right.
Thank you.
Thanks very much. Okay.
Our last presentation this morning is from Anita Tressler for the Bluewater International Gran Fondo, and I would ask that she come forward to make her presentation and include a short video. Welcome.
All right, good morning. Thank you, Warden. Thank you, County Council, and county staff and guests who are here today. I guess I'll pull up my presentation so you can see it. That might be handy. I'm here today to hopefully share with you what I think is a good news story for the County of Lambton. I am a volunteer member of the Bluewater International Gran Fondo Steering Committee, and I wanted to just share with you some highlights of what has happened in 2016 and what will be happening in 2017, and hopefully continuing to grow into the future. I wanted to start off, for those of you who haven't had an opportunity to see this video, we have a one-minute video that really shows you some amazing highlights from our inaugural Gran Fondo last year.
August 6th, Sarnia. With last year's enormous sold-out success, the Bluewater International Grand Fondo is back.
I just can't believe how many cyclists are in Sarnia.
Experience the exhilaration as you ride through Lambton County's beautiful countryside.
It is the event of the season. Scenery is lovely, and the cause couldn't be better.
This year is bigger and better than ever, with 3 routes at 3 distances for every skill level. Whether in it for the competition or simply challenging yourself, the breathtaking views along the sparkling shores of Lake Huron await you.
And the organizers have picked a wonderful course.
Join the celebration at Mike Lear Park and take in the after party featuring a 5-piece live band, food, fun, and our very own craft beer. The Bluewater International Grand Fondo, Sunday, August 6th, Sarnia. See Enhanced Routes, learn more, and register at eigf.ca.
To the Gran Fondo from last year, and I'm not sure if any of you were there, but it was a fantastic occasion to bring people in our community together and to bring people from outside of Lambton County into our beautiful community. So in 2016, we held our inaugural Bluewater International Gran Fondo. We had 500 cyclists. The event actually sold out a month before we actually held the event. We had 3 distance routes, which will continue this year. We have the Sarnia, the 50-kilometer route, a 100-kilometer route, and a 150-kilometer route. And last year's event raised $30,000 for Bluewater Palliative and St. Joseph's Hospice. In 2017, plans are well underway and going extremely well for our second annual big event. The event has actually grown by 50%, moving into our second year. The event will be held on Sunday, August 6th, 750 cyclists in total, and we expect that it will be selling out within the next couple of days. Once again, 3 cycling routes, the Sarnia, the Lampton, and the Bluewater. Just a little bit of information for you, as you may be interested in cyclotourism and the impact this will have on Lambton County. So who's coming? These are numbers from actually last week when I had to submit the presentation. 56% of the participants so far are from Lambton County, which leaves 44% traveling in from outside of our community. 611 of the participants are from Ontario, but other destinations include Quebec, Alberta, British Columbia, Michigan, Ohio, Florida, and as far as Texas. This is what I love. I think this is my favorite slide because this speaks volumes. So the participant demographics. You'll be interested to know when you think cycling, you think fitness, you might think of a younger population. But actually, when you look at the numbers here, 4 of the participants are in the age group under 20. You go from 20 to 30, you've got 23 participants. You look at the U40 age group, 63. Here's where the numbers really start to grow. U50, 131. U60, 234 participants. U70, 162 participants. We have 23 participants between the ages of 70 and 80. And as of last week, we still had 3 participants over the age of 80 participating. So when you talk about supporting an aging, healthy aging community, this is a great example. And some demographics there just on the crossover between male and female participants. So the benefits. Physical activity is an obvious one. We are helping to increase the physical activity in this community, and I'll speak a little bit about the 12-week training program that has been a huge success in our community. We do teach safe cycling skills, so if you've been out on Michigan Line or anywhere near Blackwell Cycle on a Wednesday night, we have over 100 participants, over 135 people registered, and a weekly 12-week training program where we're teaching people safe cycling skills. We have certified, trained cycling coaches that are there to help grow that cycling culture in our community. The economic benefits, if you speak to any of the cycle businesses in our community, they will tell you that they have had exponential growth in business. Even looking at the people who came out last week on or last year for the inaugural ride on their coaster bike, who are now riding a new road bike. If you were to talk to James and John at Blackwell Cycle, they'll tell you that in the 1 hour before every Wednesday ride, they're selling well over $500 worth of sales just in cycle parts and supplies. We're definitely growing the cycling culture in Lambton County. If you go out on any weekend, you'll see a significant number of cyclists on our beautiful county roads. We're growing cyclotourism and working in close partnership with Tourism Sarnia Lampton. And we're really helping to grow social connectedness. And again, you go out to any coffee shop, any pub on the weekend, and you'll see all kind of bikes parked outside. Wednesday night rides, just a few pictures to highlight the phenomenal stories that we have, the people I have met. individuals who, one gentleman I ride with who had a quadruple bypass months before joining our Wednesday night rides. Last year rode a 50K. This year is riding the 100K. The stories are phenomenal. The social connection, the relationship building. It's just been such a wonderful thing to be a part of. Partners and sponsors, just wanted to highlight that we have over 60 sponsors in our 2017 event. Happy to report that 100% of our sponsors from last year have all returned, and we brought on 15 new sponsors in 2017. County of Lambton is one, so thank you. Sponsorship includes national and international companies. Just wanted to speak a little bit too about where that money that we're raising through this event is going. So in 2016, we raised $30,000, and really Dr. Glenn Madison is a big part of the planning and the steering committee for this event. We're looking to grow support for palliative care in Lambton County. So last year, $30,000, the charitable donation was used as an educational palliative scholarship to send 5 local nurses to the 21st Congress of Palliative Care in Montreal. This is a phenomenal opportunity. This is an international conference that happens twice a year with over 2,000 well-respected people in the field, professionals and specialists. Those nurses then in turn came back to our community to teach their peers and their co-workers. In 2017, Dr. Madison has taken his dream and expanded it. So $40,000 plus is projected that we'll raise this year to support the first ever Lambton Palliative Care Retreat or Conference. And it will be held October 5th and 6th at the Oakwood Inn in Grand Bend. So some really great things are happening. So I just really wanted to close right now and say to you that on behalf of the Bluewater International Gran Fondo Steering Committee, to County Council, to Jason Cole, who's been a wonderful support, to Tara Pounds, who's been a wonderful support, and to Councillor McDougall, who was there from the get-go last year riding along with us. We just want to say thank you, and we hope to have continued success in the community with this event.
Thank you for that presentation and update on what's happening. Any questions? Seeing none, thank you very much. We wish you a successful event.
Great, thank you.
And perfect weather for the day. So as we move forward, does council want a 5-minute stretch break, or do you want to carry on? 5? I'm hearing 1 5. We're going to take a 5-minute break and we'll come back. And I will call us back to order. Thank you. We're at item number 8, minutes of the open and closed session from June 7th. I have a mover and a seconder on those. Councillor Marriott and Councillor Gillis. Questions? Councillor Arnold.
Thank you, Warden Weber, on page 52 under other business. And I just want to make a correction. I did not attend the Major Chiefs meeting. So it was just that there were people attending and then I saw the water walkers there. So, but I was not in attendance.
Okay. So noted. Any other comments? All in favor of that? Opposed? It's carried. Item 9 is Tourism Sarnia Lampton minutes from March 16th. A motion to receive for information. Councillor Boucher, seconded by Councillor Gillis. Questions? All in favor of that? That's carried. Thank you. Item number 10, this is Finance, Facilities and Court Services, Bioindustry Innovation Canada, and there's a report and a motion on that report. Some recommendations there. The mover by Councillor Buzowicz, seconded by Councillor McDougall. Questions on this report? Would our treasurer like to comment on this, or is there any questions? Seeing no. Councillor Arnold.
Thank you, Warden Weber. And I just go back, and the only concern I have around this whole process is that, when we have a fair board come in and want $500, they got to go through about a 20-page budget to prove that they want the money and need the money, and yet we're looking at $4.5 million. And I think it's only prudent that these good folks, they share their budget with County Council. It's not something that I don't think is secretive for any of us and them, but I've never seen one since I was a warden. And also that I'd like to see something put into this motion if we can, or maybe it's already been addressed, that these investments would be for people that are investing in Lambton County, because that's not the mandate of BIC. They're Canada-wide, and they've done a great job all over. But I think that if the money's coming out of this county and that we're going to back it with cash out of the ratepayers of this great county, that it should be a Lambton content on anything that our money's being invested into that we're looking at lending and propping up with.
Mr. Innes, are you prepared to speak to that?
I will try and attempt that, Mr. Warden. As Councillor Arnold indicated, the mandate of the SCA BIC is for Southern Ontario. It is not restricted to the Southwest or to Lambton County alone. The funding agreement from FedDev indicates that the intent is for them to invest in appropriate companies within that total geographic area. When we've had some discussions with them, they have indicated that they would try and maintain the portion of the portfolio consistent with the amount that we are providing into it as an investment to be in Lambton County here. I'm not sure whether the putting that restriction in, what the implications of that would be for the federal funds, to be perfectly honest. But again, we can have a conversation with them. In the recommendations, we do indicate that there has to be an agreement on the investment that is ratified and brought back to Council before those funds are invested. The intent here is to make sure that we can answer the questions of Council and bring something forward to you that you can then understand exactly what is happening. So it does not explicitly state that in here, but if that is the intent, then we can have a conversation with Mr. Marshall and his board with regards to that and determine whether or not it is possible or what the implications would be, and bring that back either in a report or as part of the agreement that is going to be negotiated this summer.
Okay, thank you. Any other comments, questions? All in favor of the motion? That's carried. Opposed? Carried. Committee minutes. AM committee minutes. I would call on Councillor Gillis to present these minutes.
Thank you, Warden Weber. The Infrastructure Development Services, Public Health Services, Cultural Services Committee met on June 21st. We had a robust discussion on a variety of issues, and I present the morning's minutes to you.
Okay. Infrastructure and Development, item 1 is correspondence received. Item number 2, correspondence referred to staff. Item number 3, information reports on Emergency Management Coordinator activity. Item 4, information report on Woodlands Conservation Officer. Item number 5, information report on Infrastructure Development Services, Natural Gas Grant Program. Item number 6 is signs posted on Mondawmin Road for air brakes. Councillor Gilliland.
Thank you, Warden. I think there may be a misterm here. It says air brakes. I hope the truck has air brakes. I think they mean engine brakes in this motion.
Air brakes, yes. I believe that's you win for reading that. Thank you. Item number 7, correspondence. Item number 8, a letter to the Ministry over prescribing of opioids. Item number 8, information reports. That was number 9. Item number 10, volunteers of the youth to meet with our MP. Other business was legislation of marijuana, item 10. Item 11. Item number 12, regarding donations to libraries, recognition. Item 13, museum appreciation. Item number 14, 15 in camera, and 16. Item number 17, motion to adjourn. Councillor Gillis.
Thank you, Warden Weber, members of County Council. I move to accept the adoption of these minutes.
Seconded by Councillor Marriott. Any further questions? All in favor? Opposed? That's carried. Thank you. The draft official plan review committee minutes. We present these. There was one motion through that report, and there's a recommendation in that on proceeding with the draft official plan. Is there comments or concerns on that motion? Someone prepared to move that motion? I guess there's a part of the discussion in there is whether a special meeting of council be held on August 7th to make amendments. Councillor Gillis? Oh, okay. So who moved that? Councillor Marriott, seconded by Councillor Han. Councillor Gillis? Okay. That recommendation has been moved and seconded. Discussion? Seeing no discussion, all in favor of that Councillor Napper.
Thank you very much, Warden Weber. Does that give all these, in there we ask that each council submit back something there. I read that. All their plans on housing lots and stuff, that they were supposed to have them back to that committee meeting by that time?
The plan through this discussion, I believe, was to have, if council is going to, or this committee is going to meet following this meeting for a short time, to look at the changes that have been presented by the official plan review committee. Those changes, if they're acceptable by that committee, are going to be sent to all council with a timeline and when they would come back so that they can present it for council discussion at the August 2nd meeting that would be called. So each of those items are changes that have been suggested by the committee will come back to a meeting on August 2nd, and there's time in between today and that meeting for councils to look at them. One final time. Any other questions? Going to call the vote. All in favor? Opposed? That is carried. Thank you. Committee PM minutes. I'll call on Councillor McDougall to present this minutes.
Warden Weber, members of County Council, the Long-Term Care, Corporate Services, Finance, Facilities and Court Services and Social Services Committee met on the afternoon of June 21st, 2017. I present to you that day's minutes.
Okay, thank you. Long-Term Care Division, item 1, correspondence. Item 2, information report, home accommodation changes. Item 3, long-term care invitations. Item 4, correspondence. Item 5, Southwest Integrated Fiber Technology Partnership Agreement. Item 6, regarding 2017 tax capping. Item 7, correspondence. Item 8, information on pilot projects updated. Item 9, information on Social Services Division. Item 10, Ontario Works budget. Item 11 is adjournment. Councillor McDougall.
Warden Weaver, members of County Council, I move the adoption of that day's minutes.
Seconder for that motion. Councillor Mcgovern. Any further questions? All in favor? That's carried. Thank you. And the Audit Committee minutes.
Warden Weber, I chaired that meeting, so I will say that we met on June the 21st at 2 o'clock, and I present the minutes of this meeting to the council.
Okay, thank you. Item 1, the appointment of the chair. Item 2, the financial statements authorized for release and distribution. Item 3, the adjournment. Councillor Gilliland.
Thank you, Warden Weber. I would move that we accept this report.
Seconder, Councillor Han. Any questions? All in favor? That's carried. Thank you. We have no items tabled from a previous meeting. I see no notices of motion. Other business. Councillor Bruzewicz.
I feel obligated to report to you, and most importantly, the public, that I have the serious cybersecurity breaches to my online presence. It began with notification from Facebook that malicious software infected my thing. I was able to deal with that fairly quickly using Kaspersky antivirus software, and I thought everything was cleared. However, the peace didn't last very long, and it appears right now that someone hijacked my personal Facebook account. There's some messages that I never sent going to other parties. And anyway, I would like to share that with you. If any messages come, that it all spreads through the personal messaging. Right now, I suspended any activity that way until I clear it. And, so far, whoever is the third party that is doing it, they going at very slow. Generally, they hit one individual who is on my friends list, one at a time. I have about 4,800 friends on Facebook, so it may take a while. But I will not be sending any messages, so I'll be cautioning everybody not to open any of private messages to me because there could be some viruses going with it. I'm sad to, it's not the first time, well, this time looks the serious, the most difficult, but I would just like to caution everybody. And I would also ask anybody who opens it and sees it to report back to me so I could evaluate the damage that was done there. It appears this time to be limited only to Facebook, not the emails or anything, but as sad as it is, it is what it is.
A caution and a public service announcement to be careful what can happen to your personal information. So thank you for that. Councillor Arnold.
Thank you, Warden Weber. I have three little quickie things. First, I'd just like to invite everyone to participate in the July 15th River Trail Run. It starts at Brander Park for registration early in the morning. It starts at 8 o'clock in the morning. And I know there's a lot of tremendous people that are in great shape on County Council, and they'd love to participate. The second thing I'd just like to make a comment on, John was good enough to send me a link the other day in regards to a new power line that's going across and going to be buried in Lake Erie. And it'll be the biggest electro-fishing wire that's ever placed underwater in the province of Ontario. And you really wonder what the reasoning is for that. But it's a 6-inch cable, if you could imagine the juice that's going to go through that puppy. And so we'll be able to pick up some really nice jumbo perch on floating on the top of Lake Erie maybe someday. And the other thing that I'd like to do, or like to ask staff for, and this is of course far more serious, and that's if we could get a report or maybe even the possibility of a presentation in regards to Line 5 issues going through the Straits of Mackinac. And I know there's quite a concerted effort. I heard quite a bit about it when I was at the Great Lakes Mayors Conference. And there's a real concerted effort to have that line discontinued. And there's some safety concerns and issues. I listened to a large discussion with the mayor of Mackinac Island, and very concerned. And they're going right through to the federal government in the United States in regards to it. So I think it'd be great if, I believe it's an Enbridge line, if they could come and give us a briefing on what they're doing to secure that line and the possibility of the future of that line and what their contingency planning is going on about, because it affects our major industrial employers in this community. So I think it'd only be prudent if we could ask Enbridge to come and give us a presentation on what's going on with that. And the biggest thing to me is the mitigation. I know there's concerns, but what are you doing to make sure that everything's okay?
Support the cause. Okay. Any other business? It's something I was going to comment on. It's gone. Okay. Notice of bylaws. Stefan?
It's moved by Councillor Gillis, seconded by Councillor McDougall, that bylaw 22 of 2017 as circulated be taken as read the first and second time.
All in favor?
It's moved by Councillor McDougall and seconded by Councillor Gillis that bylaw 22 of 2017 as circulated be taken as read a third time and finally passed.
All in favor? It's carried. And motion to adjourn. I guess before I do that, I thought of what I wanted to say. I want to congratulate all the communities throughout Lambton County that supported the Canada Day celebrations. I got to as many as I could. I know I missed a lot, but everyone was out and every community did a real bang-up job. The community support was there throughout the county. So congratulations for everybody and all the organization teams that put that together in each of the communities. So good on you. Motion to adjourn, and it will be a motion to adjourn, and we will meet at the August 2nd, as was put through the minutes. Do you have a comment?
I'm sorry, Mr. Warden. It just dawned on me seconds ago. We've got the AMO meeting coming up in August, and I think the August committee meeting is still set for the Wednesday. Typically, we move the committee meeting to the Thursday to allow people to come back. So we may have to, if I'm correct with those dates, then we're going to have to switch the committee meetings from the Wednesday to the Thursday.
Okay. A motion to adjourn and have the next meeting on August the 2nd for County Council and move the committee meetings to the Thursday of August, whatever the date that is. So, Councillor Gillis, second by Councillor Mcgovern. Questions regarding that? All in favor? That's carried. And we'll sing "O Canada," and we should have the young gentleman that sang in St. Clair Township here on council to lead us. He did a fantastic job. So, "O Canada."